My name is Jeff Tiedemann. I'm a hand and upper extremity specialist. I've been with Gross Iverson, Cradle and Klein for 15 years now. I suppose my approach, although I'm a surgeon, I still tend to have a fairly conservative approach. I think anytime you see a patient with a problem, you try to develop a treatment plan, starting with the simple, straightforward approach, and then perhaps become more involved depending on how they respond initially. 27 bones in the hand and wrist, and they all are intimately involved with one another and need to work properly in order to carry out all the functions that we take for granted on a day-to-day basis. Well, I think if it's perhaps a sports-related problem, for instance, this time of the year we see a lot of baseball players with elbow and shoulder problems from the amount of throwing they've been doing for months. I think the best approach is preventative, to try to prevent a problem from developing in the first place. And that includes proper mechanics, stretching both before and after the exercise, icing the area of involvement, and most of all, just not ignoring symptoms if they start to develop and allow it to become a more serious or significant problem. As far as protective steps that people can take to try to prevent problems, certainly from an ergonomic standpoint in the development of carpal tunnel syndrome, it's appropriate that they make sure their wrists are positioned properly, that their forearms are supported, that they don't continue with one specific task for a long period of time. People should get up every hour and do some generalized stretching, especially with their hands and fingers. It's when people continue to do one particular activity for a long period of time, especially if their wrists or arms are in an awkward position, that they're set up for having repetitive trauma problems.